Ebola virus disease part 2. Signs and symptoms of Ebola virus disease. The primary signs and symptoms of EVD are fever, body aches and pains, weakness and fatigue, diarrhea, vomiting, and abdominal pain. Other symptoms may include red eyes, skin rash, and hiccups. Hiccups are sometimes seen in the late stages of EVD. Many common illnesses can have the same symptoms as EVD, including influenza, commonly known as the flu, malaria, or typhoid fever. Diagnosis of Ebola virus disease. Because the signs and symptoms of Ebola virus disease are very similar to other illnesses, reporting of symptoms and possible exposure to Ebola virus are important when making an EVD diagnosis. Determining an EVD diagnosis must include a combination of the following. First, the person must exhibit signs and symptoms associated with Ebola virus disease. And second, there must have been a possible exposure to Ebola virus within 21 days before the person's symptoms began. Diagnosis continued. Exposure to Ebola virus could include any of the following: blood and body fluids of persons who are ill with Ebola virus disease, semen of a man who has recovered from EVD until testing shows that the Ebola virus is no longer in the semen. We will discuss this in more detail a little later. Items that may contain blood and body fluids of a person infected with or who died from Ebola virus disease. The blood and body fluids of bats and non-human primates such as gorillas, monkeys, and chimpanzees. And lastly, exposure to bushmeat. Diagnosis continued. If a person shows signs and symptoms of EVD and there is a possibility that the person was exposed to Ebola virus, there are certain actions that should be taken promptly. The person should be separated from other people. Public health authorities should be notified immediately, and blood samples should be taken and tested to confirm Ebola virus infection. This will be done by public health or medical personnel. Polymerase chain reaction, also known as PCR, is a common diagnostic method used to test for Ebola virus infection. PCR is used because this method of testing can detect small amounts of Ebola virus in blood samples. Therefore, symptoms have to be present for PCR to be used. Other testing can be done to detect Ebola virus antibodies. Diagnosis continued. This is the last slide about EVD diagnosis. A positive laboratory test means Ebola virus infection has been confirmed. Public health officials will then conduct an investigation to identify people who were in contact with the ill person, so testing and, if necessary, supportive treatment can be initiated for the people who were in contact with the ill person. This is the end of Ebola virus disease part 2. Please continue to Ebola virus disease part 3.